Anemias. Anemia is a condition in which there is decrease in hemoglobin, red blood cells, or oxygen carrying capacity. Hemoglobin, RBCs, and O2 carrying capacity. Now, there are types of anemia. There are 8 basic types. The first one is iron deficiency anemia. In iron deficiency anemia, there is lack of iron. This type of anemia is common in women, in pregnancy, and in malnutrition. The features of iron deficiency anemia are pale skin, fatigue, and spoon-shaped nails. In labs or investigations, there will be low Hb in the CBC, low ferritin, and there will be microcytic hypochromic RBCs. The second type is megaloblastic anemia. The causes are vitamin B12 or folic acid deficiency, and the common features of megaloblastic anemia in patients will be glossitis or numbness or weakness. On labs or CBC, there will be macrocytic RBCs and there will be low vitamin B12 or folate. The third type is pernicious anemia. It is autoimmune, and the autoimmune lack of intrinsic factor is present in pernicious anemia. There is poor B12 absorption and it leads to neurological symptoms. The fourth type is aplastic anemia. The causes are bone marrow failure and it may be due to drugs, radiations, or infection. The features in aplastic anemia are fatigue and bleeding infections. In lab, there will be pancytopenia, that is a decrease of all blood cells, red blood cells, white blood cells, and platelets. Hemolytic anemia. There is increased RBC destruction in hemolytic anemias. The types are sickle cell anemia and thalassemia. In labs, there will be pancytopenia, that is decreased RBCs, WBCs, and platelets. Okay, so whenever CBC is done and there is decrease all red blood cells, white blood cells, and platelets, so there we have the differentials of hemolytic anemia and aplastic anemia. Then we will classify that or identify that by the if it is genetic or the patient is having family history of thalassemia, then it may be thalassemia. And if we want to diagnose it as aplastic anemia, then bone marrow biopsy is done. Sickle cell anemia. The cause is genetic, that is HbS abnormality, and the features are pancreatitis, anemia, and infections. It is common in African and Mediterranean people. Thalassemia is a defective hemoglobin chain production. Whenever hemoglobin chain is formed, there is a defect in hemoglobin, and that is thalassemia. The anemia of chronic disease is caused by chronic infections or inflammation of kidney diseases, and the features are mild to moderate anemia. The labs normal or high ferritin or low serum iron. Now, how you will classify it as a microcytic and macrocytic? So, the iron deficiency anemia and thalassemia are microcytic, hypochromic. In peripheral smear, the RBCs will be microcytic, and hypochromic. While when the peripheral smear is done in megaloblastic anemia and folate deficiency anemia, the RBCs will be macrocytic. Also, in aplastic and hemolytic anemias, also the RBCs are macrocytic. So, the microcytic anemias are iron deficiency anemia and thalassemia, and the macrocytic iron deficiency anemias are megaloblastic anemia, hemolytic anemia, aplastic anemia, and vitamin B12 or folate deficiency anemias. Okay, so a random question is that a patient came with the anemia, and we have done the CBC and the peripheral smear. On peripheral smear, there was microcytic hypochromic anemia, and on CBC the HB was low. So what it can be? It can be iron deficiency anemia or thalassemia. Now, how to identify whether it is iron deficiency or thalassemia? So thalassemia is usually present in the history of the patient, and iron deficiency anemia is usually due to malnutrition or pregnancy, or it is also common in women gender. So we can classify the anemias based on the history and the labs of the patient.